So good afternoon, everybody. Thank you for joining our discussion this afternoon on what is something that is very dear to my heart. I have little people in my world, and cancer has come into our family, and so I fully understand the challenges that it can bring, irrespective of where you are on your cancer diagnosis. So today's topic is talking to children about a cancer, why we talk to them and how we talk to them. I am a systemic psychotherapist and psychosocial oncologist, and I've worked both here and in North America in the area of psychosocial oncology and palliative care for the nearly 20 years at this stage. Next slide, please. So I use a childlike theme to talk about our children because I think it invites us back into our own childhood, and that's something that I'd like you to think about today as you listen to me talk. I really like Dr. Seuss for all the bad press that he gets, but essentially you have a choice when a diagnosis or an illness comes into your family. And I like Dr. Seuss's phrase of, you have brains in your head, you have feet in your shoes, you can steer yourself in any direction you choose. So whatever position you have or you hold today doesn't mean that it's right or it's wrong, but you can invite yourself to think differently perhaps after my discussion with you if you feel that there's something not quite right or not resting well with you. Next slide, please. So today I'm going to invite you to think about your story, what you bring into the mix. I'm going to talk to you about the benefits of talking, how to talk, what to talk about, and what children want to know. The discussion will be for about 30 minutes, and then we can have Q&As, and Louise, a lovely daffodil nurse from the Irish Cancer Society, will moderate a discussion of questions and answers thereafter. What I think is really interesting, next slide please, is that this is a topic that often is the first thing a parent or a grandparent will go to once they've been given a diagnosis. If they've little people in their world, they absolutely want to protect them. And I have a number of elephants in my talk because often it can be the elephant in the room. It can often be the elephant in the family. It can often be a secret, depending on the age of the children, what they do and don't know. And so today I'm here to talk a little bit about how we unpack that secret, but also the benefits of unpacking that secret. It's interesting. Each year, the Daffodil Centre has its top 10 reasons why people go and then enter their doors for information. And always within the top 3 is communicating to children. And so it says that there is a lot of people out there that are curious about this topic. So you're not alone, and the fact that you're here listening to me have a conversation today about it, those little people in your world are very lucky. Next slide, please. So often some of the reasons why we don't talk to children is we fear that we'll cause upset. And I love this phrase by Lashane. It says, a child can live through anything so long as he or she is told the truth and is allowed to share with loved ones the natural feelings people have when they are suffering. So what we do know is that approximately there are 4% of all cancer deaths in the world. There will be 4% of people who have died from cancer. There'll be 4% in their family that will be under 18. And what we know is that of all new cancer diagnoses, there's approximately a quarter of all of those, there'll be children under 18 in the family. So in 1 in 4, it impacts. So that's quite a lot statistically. I'd invite you to think about your own life story and where in your world cancer first came in as a young person. Maybe it didn't. Maybe you heard it from a neighbour. Maybe it was in your immediate family. But how was it spoken about? How did your parents talk about it? Are there relatives in your genogram, in your family tree, that have died from a cancer, that have lived from a cancer, but it wasn't spoken about or shared? Are there people in your family system whereby you're not entirely sure of what they died from? You think it might be a cancer, but it wasn't spoken about. This is really important because this informs us and lets us know, well, did that work for us as a child? Could things have done differently? And how might I do something differently to the little people in my world? So if you've children in your family right now, what's their experience if I was to ask them? And would they prefer it to be different? And what's your experience looking back as an infant or as a young child or an adolescent? And would you like things to have been different? Next slide, please. So when a cancer comes in to your world, it changes the equilibrium of the family. So what was the norm is no longer the norm, and it causes disruption to the family function. And desperately, we try to grapple to maintain the norm. And children are no different to us. They like things being the same, but it's not impossible for it to be a little deviation from the norm, but it does bring about change, and that's normal. And I suppose one of the things about this world is that change is constant. We've become very familiar to patterns, and we like to seek things that we know. We get up in the morning and we do X, Y, and Z. When cancer comes in, it changes that pattern. And so you might ask yourself, with your children, how will you cope if they get really sick, or if you get really sick, rather, how will they cope? And this is a normal and natural response. You'll wonder, how will it affect their lives? And it can seem overwhelming, but what we do know, that being open and honest with your children can help them and you cope with their illness. Next slide, please. So this is a patient of mine that I saw for a period of time, and she's 62 years old. She had an ovarian cancer, and what she said is, I have a son and daughter who are truly loving, caring adults who elude such integrity, and their beliefs in morals have made me feel so blessed. She was really proud of her children. I didn't want to show my concerns or fears to my children. We're a very small family, and being a mom, I always am in protective mode. And the reason why I shared this quote, and she's given me permission to do so, is that at the start you can see she talks about her son, an adult, and she identifies that they are indeed adults. But when she talks about protecting them, and she's 62, her children are in their 20s and 30s, she brings them back to being children. And so irrespective of where you're at as an adult, we always want to protect our children. Next slide, please. Another lady, I can totally relate to what you're mentioning, the importance of wanting to protect your kids and wanting to take care of them at all costs. While I learned that I had a cancer, my first thought was how this tragic news was going to affect my kids. How were they going to take the news? How could I make this as easy as possible for them? Again, Celine's children were in their 20s, but immediately she didn't want to disrupt their lives with her illness. Next slide, please. So the benefits of talking. So the greatest gift that we can give our children is that we can create open communication within our family. It doesn't matter what the topic is. If we can create a space where our children come to us above anybody else, we're surely doing a good job. The last thing we want is for children to become detectives in an area where they don't need to. And so it's really important where you have the ability to control content information that you do it. So just like a sex education talk, are you comfortable in sharing that and having those conversations with your children, or are you not? But if you don't, your child is going to find out about sex somewhere else, and then they will not be in a position to ask you questions if you shut the conversation down. And so cancer is another topic, and illness is another topic that you would like to create space for them to come and talk to you. And so by sending that message, this is a family that talk about things. This is a family that keep you in the loop. The child is invited into this safety and security. I trust my parents. I don't have to go investigating. I don't have to go listening behind doors. I can get what they're saying because they're telling me. And if I have questions, I can go back to them. That's a beautiful, beautiful gift to give our children. Not having to watch what you say and others, because it's absolutely exhausting. I've met people who have gotten themselves into so much complexity because they are in knots over trying to conceal this big secret of cancer. And the amount of energy that it takes to conceal a secret like this is enormous. So I sincerely recommend, from the best place possible, that your energy is best served focusing on your wellness rather than concealing a secret. Having faith in your child's ability to cope. Life isn't always happy. Life has a variety of array of emotions, and it is our job as parents to educate and mentor our children on emotional responses. They learn from us. And so if we are non-displaying of emotion, your child will mimic this behavior. So it's really important that we invite and normalize emotional responses. It's really important to let those that are part of your children's lives, the other systems outside of your family, know as well what's going on. So if your child is particularly involved in after-school programs, maybe just let them know, this is what's going on in the household. I'd really like you to keep an eye on them. The same with regards to school. Really important that the teacher knows what's going on. Again, somebody having your child's back. And letting the child know that I've told the teacher, if you need to talk, you can. You can't stop a child feeling sad. It really is a natural part of life. But what you can do is you can support them in their sadness and teach them valuable life lessons that will stand to them as they enter into adulthood and as they then educate their children if they go on to have children. Next slide, please. So how do we talk to children? So I'm often asked, would you do it, Yvonne? Would you talk to my child? Will you tell them that I've cancer? Or would you tell them that I'm not going to recover from my cancer? And I know, having worked with young children and having worked with adolescents and adults, that if they were given a choice, they would absolutely much prefer to speak to their parents about this and not a stranger. I can certainly support the adult in supporting them in telling their children. And that is one of the key roles of a medical social worker within clinical settings, is that they support you so that you support your child in telling them, because that's what the child wants. I'm a stranger to the child. I'm not enticing or appealing for a child to come into a clinical setting to speak to me. But if your child is in your car or you're taking a walk in the park, it's a really nice way of telling a child some important information. There's less eye contact, it's less intimidating, and therefore there's a created space for the child to ask questions without feeling pressurized. You are the expert in your child. I'm not an expert on your child. You are. And it's really important that you hold steadfast regarding that. There is no easy way. Both of you are investigating how this new phase in your life evolves, but bringing them along with you is really empowering for them and for you. It's key to be gentle and manage the pace that is applicable to them. And you know that because you know your child better than anybody. Next slide, please. It can be hard to talk to them. There is evidence out there that was done in 2016, and the 4 key areas that the researcher Preen identified as was that parents felt there was a lack of guidance on how to do it. So you're not alone. They felt guilty for not being a good enough parent, so your energy levels are impacted. You're not able to go and play with them in the same way. You may not be able to swim with them because of infection. You may have a stoma now and you're not able to do the things that you used to do in the manner that you used to do them. Your life may be curtailed in ways that you had never envisaged before. This is normal, and bringing your child along and explaining it to them as to why that is really important. It may require effort to maintain a routine, and there's lack of support in this country in order to facilitate doing that. So we're pretty poor in supporting people who are impacted by cancer with regards to childcare arrangements. And so this is what the research is saying, and I'm sure you can identify with the key outcomes of this. Next slide, please. I suppose, how do we talk? We normalize emotional responses. Children are funny. One minute they can cry and the next minute they can be out playing in the garden. That's normal. Their language is not to stay with sadness for very long periods of time. If you've more than one child to consider, it's important to separate developmentally who should be told what and whether they're told together or not. And so an adolescent, for example, will have a much greater understanding of the word cancer, and perhaps there's a separate conversation that occurs with them than occurs with your 9-year-old. However, it's really important that the 9-year-old knows that their older brother and sister is aware, and vice versa, and that they can talk to each other about it as well. The goal, as I say, is to keep the dialogue open. Ask them what they know, and ask them, have they ever used, if they use the word cancer, what does cancer mean to them? Like, what's their understanding of cancer? Really important that you clarify this. Next slide, please. So tell them how your health will be impacted. Explain the treatment plan in language that is clear and simple. So I often use the analogy that chemotherapy is like the sun, and that chemotherapy is like weed killer, and that radiotherapy is like the sun that can kill the weed in a different way through its heat. There will be analogies that your child will understand, that you know, in the types of play that they use. So maybe your little girl plays with cars, or is interested in being a mechanic, and so you can liken the body to an engine. Maybe your little boy plays with dolls, maybe he plays with a house, and you can liken the body to the house and the different rooms and how your cancer is impacted, and the different rooms of the house are impacted because of the illness, using metaphors such as that. But you know what your child is engaged in. I also think it's important that you let them know how it'll affect how you feel. So your energy levels might not be great. You may be in a bad mood sometimes, and that you're sorry for that in advance, and that it'll take up a big part of your world right now, but not always. Next slide, please. Just on that, it's really important to use the word chemotherapy and then explain it. It's really important to use radiotherapy and explain it. It's really important to use the word surgery and then explain it. Offer reassurance that the routine will have minimal changes. So often what we can find in families is that parents can overcompensate, and the child gets to go to such and such house, they get to go to the movies, they get to go to loads of play dates. And actually, on the short term, you think that's a win-win, but actually the child craves normality. And so while a little bit of that is fine, don't overdo it. So if it suits you to do it, fine, but don't do it for the benefit of the child, because the child will more likely just want to be around you and also want their routine back. So treats are good, but don't overdo it. Don't overcompensate. Emphasize that cancer is not contagious. Children are very narcissistic, and they wonder, hey, what's going to happen with me here? Reassure them that they can't catch it. Illness is not anybody's fault. Sometimes children think that if they've had a fight, that maybe they've caused this cancer or upset. Discuss with them how they can be involved. I had a little girl once that saw me in therapy. Unfortunately, her dad had died from cancer, but her mum was of the opinion that the stress, that they had financial distress within the house, that had caused the daughter's disharmony. And the family had continued to have financial distress. And so the daughter in therapy, and she was 10, was fearful that her mother would get cancer because the financial stress had still existed. And as far as she was aware, that the distress of the finances had caused the death of her father. Focus on love and support that you have for one another at the end of the conversation. Really important. Next slide, please. So ages and developmental stages, people often laugh at me when I put up infants 0 to 2, but actually they have needs and they pick up when change happens to their routine. So again, meeting their physical and emotional routines, using simple language. Again, like I've discussed, mommy is sick, it's called cancer, she's going to the hospital, that's where people get treatment. Routine is key. Next slide, please. So preschool 3 to 5, so they have a basic understanding of illness, but they also have this lovely magical thinking. They believe sometimes that illness is contagious, and they have a disconnect of what they say and what they feel. So they might be upset, but they might be laughing, or they might be the opposite. They might be laughing, but be upset. Children can revert to thumb-like sucking their fingers. They may want to go back and share a bed with you if that was something that they did before, or maybe they've never shared a sleeping space with you, but they may ask to do it now. So this is all normal. They may wet the bed. They may get upset when you're leaving. This is normal. Make your child feel important and included. So if there's ways that they can help you, i.e. mommy would love a glass of water, or daddy would adore if you tickled my hands, that gives me a really warm feeling, and it makes daddy forget that he has pain in his tummy. A child loves to be involved in part of the care plan. Next slide, please. So children between 6 and 12 have a greater understanding. They have a more complex understanding of the term cancer, but however, they may be prone to miseducation. So it's important to educate them. Again, their behavior may regress, and they may respond to providing appropriate reassurance. So the idea is, again, routine, that things will get back to normal, and take the time to listen to them, and by allowing children to feel included, just as I have mentioned before. I always recommend, once you've had a very serious conversation, particularly with younger children, ask them a number of days later to draw a picture of their family, or draw a picture of the big discussion that we had, and see how they constructed through their lens. Often what you can find is you learn a lot about what our children draw, because that's their language. It's not words, it's pictures. Maybe even create a collage. What is it that mommy told you or daddy told you? It's really important as well, where possible, if both parents or both grandparents sit down with them and tell them together, because the message that you're sending your child is, oh, okay, I can talk to either of my parents about this, and they're united. So both of them are united in their ability to talk to me, and I can talk to either of them. Really important message to your children. Next slide, please. So I share this with you. A number of years ago, one of my very good friends, her sister completed suicide, and I got a call that I hadn't been expecting, and it caught me off guard. I was quite upset on the phone when I heard the news, and at the time I had two of my children in the presence in my company. And when I hung up the phone, they know my friend very well. They asked me why I was sad. I had a choice at the time to not tell them, to give them some non-truth. But I chose to tell them. But suicide hadn't been something that had been part of my world previously. And so I did have to think on my feet at the time. And I used the term suicide, and I explained that somebody had pains or invisible pains in their head that were difficult to treat with medicine, and unfortunately they had killed themselves. They had committed suicide. They didn't ask me how they did that, but probably within the hour I asked them to explain what it was that I had just shared with them. And this is what my 6-year-old at the time spoke or translated to me on the paper. So she spoke of the lady on the right, and as you can see, she's smiling, but the love is going out of her, and the sun is shining over her, and then the sun goes dark, and the love is being translated into her, but she is no longer happy. I thought it was a really brilliant way of describing what it was that I had explained in such a short time, but also really difficult and complicated topic to discuss, but she got it. Next slide, please. So teenagers are more difficult to keep on board. So they have a more complicated understanding of cancer. They're more adult-like in their understanding, but they are and can be prone to misperceptions as well. And again, it's really important, what is their world allowed in with regards to illness? So has there been people in the family who have been living with the cancer and beyond it? Has there been people in the family who've died? So what are the messages their family and society has sent around illness and particular cancer? And so really important to unpack that with them. It's a critical time developmentally for them. Teenagers want to fit in, and they don't want to stand out for all of the wrong reasons. And so it's important to have conversations around that. Parents may respond to their emotional behavior needs by encouraging teenagers to talk. Setting appropriate limits, again, not letting them run off the rails because you feel that that's your guilt and because they can't, or you're not available to them in the way that they were, that they can have an open door policy. Again, setting boundaries is really important, and encouraging them to maintain social outlets and routines. So just because you're sick, their world doesn't have to stop, and facilitating that. Next slide, please. So the next part, this my second elephant, is I talk about the worst party in the room, the worst party I've ever had, rather. I'm in a room full of people and everybody ignores me as if I don't even exist. I liken this slide to incurable cancer, or people who will not recover from a cancer, who may live for a very long time, that it behaves chronically, but that eventually it may end or cause the end or the death of yourself. And the reason why I talk about this is lots of people don't talk about it, and it adds further to the stigma. I meet parents who are desperate to talk about it. And normally when I do these talks, it's in person. And what I find is a lot of parents have spoken about a cancer, but if they have an incurable cancer, they haven't spoken about death and dying, and that it's a topic that often goes unspoken about. And I feel I do a disservice to all of the parents and grandparents that I have worked with over the many, many years by not talking about it. And so it's to them that I talk about it. Next slide, please. Next slide, please. And so talking about death and dying is possibly one of the most difficult tasks a parent can do, is to tell them that they're not going to recover. There is no easy way, but similar to what we've discussed before, it's important that you come to terms with the facts first before you proceed to do it. It's important that language you use is clear, again, that you use not recovery, death and dying. It's important that you use that. One thing that we're very good in this country, particularly in RTE, is they tend to use the word passing a lot. So somebody has passed away. This is a very confusing term for a child. You pass a car out. And so when you pass, it's while the language is quite soft, it's a very mixed message. And so really important to be careful of the language that you use around this. Children are heavily influenced by parental emotional responses. This is a sad topic. And so it's important that you guide them through the process. It's really important that you foster hope. So just to be mindful of that. And so when we talk about the type of things that may come into your world with an incurable cancer, some of the topics that you might want to discuss is the area of palliative care, their role, how they support illness. They don't make the cancer go away, but what they can do is they can help mommy and daddy or grandparents or significant others to live a very fulfilled life where I will have a better quality of life than I do now. So there's lots of help again within acute settings around this. Next slide, please. So this is a lady who has kindly allowed me to share her talk. So she's somebody who attends me for therapy, but she says, and she's remembering herself as a child, I remember the pain in my heart the day he died. She's referring to her father. Everything was so sad, so dark. The long nights lying in bed, wishing I had known that he was leaving us. My mum would always remind me of how much he loved me and that we would get through it. She was right, we did. I suppose what I find is, next slide please, is that one of the lovely things about cancer is that it allows us to talk to our children. But one of the complicated things is often families fail to take up the time to prepare, particularly if your cancer is incurable. And so what we know is that it doesn't have to be the focus, but by creating a space and having that conversation, it brings the child along the loop and it keeps them abreast. and it allows for deepening of conversations that may never ordinarily happen where sudden death occurs. Don't be afraid to say, I don't know. There are many mysteries about death and dying, demonstrating that you're there for them irrespective of how upset they are and what questions they may ask. Again, using child-friendly expression, crafts, sports, music, dancing and writing, ways that a child can express their emotions. That's their language. Really important that they're part of their lives. Next slide, please. What children really want to know. They want to know, will it be okay? Will they be okay? What does death feel like? What happens after death? And this is a real opportunity for you to connect to your child in a way that ordinarily conversations may never occur, as I say, in comparison to a sudden death. So what's your beliefs and values around death and dying, and how can they translate to a child? And they'll want to know, is it their fault? Next slide, please. Will it happen to them? Who will take care of them and their family and their things? What happens to the relationship in death? And again, that's your values and your beliefs. The role of memory boxes, I'm not going to go into this, but it's pretty self-explanatory. But again, there are people in acute settings and in hospices that will be able to assist you around this process. Continuing bonds. What we know about bereavement and what healthy bereavement looks like is that we never get over a grief. It becomes part of our world. And how we grieve that person is through continuing bonds for the vast majority of us. And so what I mean by that is that maybe you have the opportunity to have a conversation with your child to say, you know, the way we love dogs. Well, every time you see a dog, think of me and I'll be thinking of you. And so that is an example of a continuing bond. And so what the hope is that when a child sees a dog, they think of their loved one and they have a nice feeling. That's a good and healthy bereavement outcome. Next slide, please. So here are some resources. I've given my email address at the start. Please feel free to email me and I can send you more resources. I have lots in PDFs and that about what I've just spoken about. The first one, Breaking Bad News. If you have a child with an intellectual disability, this is an excellent site to guide you through the process along the lines of what I've discussed, but really helpful videos as well. The others, the Irish Cancer Society, there's a lovely Australian society in the Macmillan as well. There's also a podcast that I've done on the answers to cancer, which goes through some of the items that I've discussed again today. Next slide, please. So this is a little bit of my own story. So my father-in-law was known as Pops, and he died a number of years ago through as a result of a cancer. And so one of the ways that we explained to my children, or our children, that we couldn't play with Pops in the way that we had previously because he was getting frailer, was through a Dr. Seuss story. And so hop, Pop, we like to hop on top of Pop. Stop, you must not hop on Pop. Next slide, please. So this is a lovely Dr. Seuss book again, but it's called My Many Coloured Days. Normally I show a video, but I don't have time to do it today. But this is a really lovely book on normalising children's emotional responses as it metaphors colours. It can be helpful for both you to talk about where you're feeling and what colour you feel on a given day, but also it's really helpful for children as well. This is another book as well, The Big Bag of Worries. It's really nice. It allows children to discuss the benefits of sharing the worries that they can carry, particularly when an illness comes into their world. Next slide, please. So my final elephant is to support your child is to include your child. Keeping them in the loop is the biggest gift you can give them, irrespective of where your cancer treatment is at. If you are parents who are both of different opinion, one saying to tell and the other saying not to tell, and I encounter this a lot, Both of you love your child equally, but what we do know is that children fare better when they're kept in the loop. Thank you very much for listening, and I'm open to questions.
Thank you, Yvonne. That was really good and really useful for some of our parents and patients watching this morning, or this afternoon, sorry, because it can quite often be such a difficult thing to navigate by themselves, and they can really struggle with how or where to start on this quite daunting approach with kids. And it's just great to open the conversation and to be able to start them on that journey it is that they need to navigate their own children. I do have a question here from a lady here, Jennifer, who's recently been diagnosed with de novo breast cancer. So she's got metastatic breast cancer to the bone, unfortunately. She's 2 kids, 11 and 13. She's not having surgery, chemo, or radiation. So she's feeling really well. There's no signs that she's having treatment that her children would notice. And her day-to-day life, her routine hasn't really changed. She's only going to the hospital once a month. So what would your advice to her be? Do you think she should tell them now, or can she hold off telling them and kind of spare them that right now while their everyday life hasn't really changed, to bring that upset kind of forward? What would you think would be best for those kids?
Hi, Jennifer, and I'm sorry that you're not in the room with me, and I am sorry that you're going through this. So I suppose I'd be curious to know what they know. So if I had your 11 and 13-year-old right now, I would wonder, what do they know of your illness? So that would be my first curiosity. I think because you're well, it sends a really good message to your children, as opposed to you becoming unwell and then telling them in a crisis. So I would think when you tell them sad news, but they're able to see the lived experiences. Well, my mum has an incurable cancer, but she's actually really well with it. That sends a really positive message to your children, because if you tell them when you end up in hospital or maybe you get acutely unwell, then it's a big crisis and then it's all very frantic. Whereas your lived experience right now is very reassuring for them. And with regards telling them, are you curious about telling them about that you will die as a result of the disease, or you just haven't told them anything at all? So if you can let me know that, I can perhaps guide you there as well.
That's really helpful. Thanks, Yvonne. I suppose the point of view from, well, Jennifer actually has got back to say it was discovered as a result of back pain, and they knew that she had that, and then they see that it's gone, so they don't know okay. That it's more serious than that, I suppose. Yeah.
Okay, so they're completely in the dark then, Jennifer. And I'm curious about, again, this is just for you to think, I'm curious about the decision of not having treatment. Is that coming from you, or is that coming from the physicians? Is that something that you've chosen or not? So, because part of our conversations with children is often explaining treatment, why we're having treatment, why we're not having treatment. And so getting an understanding of that yourself and what your position is, that will be helpful for your children as well. Because I don't know what their understanding with cancer is. It sounds like they haven't heard of the word from you, but I would be again, Jennifer, you're the expert on your children, but if it was me, and I can only own me, I would be bringing them along with me. Because cancer isn't a scary word to a 3-year-old. We make it scary by not talking about it. We make it scary by saying, this is so bad, we can't mention it. But if we talk about it, we're putting adult meaning on a word that may mean nothing to our children. And so it's to try and decode that word and not make it scary. So I think gentle steps, Jennifer, right now, because it sounds like they're not in the loop at all. So I would start by thinking about that. And if you have a significant other, I would bring them along the route with you as well, because again, it's telling the children that they can speak to both parties. So I hope that answers your question.
Great, thanks, Yvonne. I have another lady here, Siobhan, who just wanted to thank you for a great presentation today. And
Thank you.
said she has a 9-year-old child, and who's totally amazing. And she was to tell her the truth. So I don't know, to clarify, Siobhan, have you told her the truth, or you're going to tell her the truth? I can't understand that, but yeah, she sounds like she has a really, really good child who's involved maybe there, and who's 9 years old. So that's good to hear that feedback.
And I'm sure she'll
I
continue
suppose,
to be totally amazing.
yeah. I suppose, what we see as well is just to broach the topic. I think parents are afraid to break down in front of their kids. They're just afraid of their own pain, and that they'll project that pain onto their child and then leave that child with the pain, that they might cry or break down. And I suppose, like you said, when you're walking in the park, it's more kind of informal and less scary as well, and putting it into their words. Because a lot of parents seem to really struggle with their emotions and feeling like they're the strong person and having to be the strong or the pillar or the rock for their child. But would you tell them, like, it's okay to show your child you're vulnerable, that you're upset, or what if you cry with your child? Like, is that something
100%.
people might be, if you see people are afraid of?
100%, because if you don't cry, then in some way it doesn't give them permission to cry. Now, maybe you don't feel like crying, but you can say, Mommy has cried about this before, and Daddy has cried about it, and so has Grandma, and so has Granddad, and so has Auntie Paula, and so has Auntie Mary and Uncle John. But we don't cry about it all the time. And today, Mommy doesn't feel like crying about it, but sometimes I do feel like crying about it. And so if you see Mommy crying, this is normal. Because again, we're the mentors of emotional responses to our children. So look back to your own parents. Were you exposed to upset or sadness in your family, or was it a very, we don't talk about things in this family. We put our emotions and we box them away. And how does that influence you now? So for me, absolutely, really important. Normalize emotional responses. They learn from you. And I just see Siobhan has said that she told her the truth, and that obviously it worked out well. Congratulations, Yvonne. Well done, you.
Yeah. And I suppose even talking to colleagues, we see on the nurse line, the cancer nurse line, that a lot of parents would say that we've wanted to protect our child or shield our child, that we haven't told them, and they especially haven't used the word cancer, which is what I'm picking up from you today, is that you're kind of reinforcing that it's really important to use those difficult words, because for kids, they seem to cope better. Is that the message, the take home message?
It leads to avoiding a miscommunication. Sometimes people, like even physicians, are sometimes use humor.
Yeah.
And sometimes people, benign
humor.
Humor. And so a patient can leave thinking, oh, it's grand, I not fully understanding. And children are exactly the same. And so we educate our children what the word cancer means. And therefore, if they have a question or a difficulty, we're very clear in our language that there's no miscommunication. It's the same, and I bring it back because I have a huge interest in psychosexual impact with regards to cancer diagnosis, but I bring it back to educating our children around our body parts. So some people might have a different name for breast or vagina or penis, but actually you want your child to be using those names, because again, that there's no space for miscommunication, and cancer is no different.
Yeah, and I think us adults could get better at that. Like you said, even in adults, some doctors or some nurses, they struggle with these words and how difficult it is because of their own emotions to come out in front of someone when you feel like you're, trying to be strong for them. And if parents do sort of be honest and do all the right things and tell their children, but their children really, because they're trying to shield it because they're afraid they won't cope. But then what if that child actually doesn't cope very well? What's your advice for that sort of a situation? When should they look for help with that child, and how can they look for help for that child?
Yeah, great question, Louise. And I suppose that's parents' fear, isn't it? That's the deterrent.
Yeah, that's what stops the chat.
Yeah.
Honestly. Yeah.
Great question. And I suppose firstly, you work through the layers before you start pathologizing anything. And so firstly, I would see, like I said, children can regress in their behavior. Routine is important. My first protocol would be to go to your centre, speak to your clinical nurse specialist, your medical social worker, see initially, is there something that you can do locally before outsourcing or trying to, how are you coping? Because often, again, if you're not coping well, the child may be picking up on that.
Yeah.
And so is it the support that's needed for you? I'm a systemic therapist, so I work with systems, family systems. So it's not uncommon for me to have both parents and child in the room, or children in the room. And so sometimes it might merit that type of approach. Again, but I would be saying, look, if I was to ask your child and say they were kept in the loop, and I asked them, how is mommy and daddy coping? What would be the changes that you've seen in mom and dad? What would they tell me? So start from that and then work backwards, because maybe there's something about that that's influencing the child's behavior, or maybe there's not, but it's about being a detective yourself, trying to work it out. But go back to your treating centre. There's loads of support out there.
Yeah.
At ARC, with children, more often than not, we have to go privately for specifically help with children. And if anybody wishes, again, I have loads of a PDF that, Louise, if anybody emails me there, I'll give it, where there's lots more information, lots of books, workshops and that. But my first protocol would be to go back to your referring treatment centre and get it.
Yeah. And also, I suppose, for the Irish Cancer Society as well, they do have like local daffodil centres. If you live near a cancer centre, there's the online number, which is a free phone number for parents just to ring and bounce that situation off someone and get their advice, just to start the ball rolling and how to manage that situation. And then there's really another good booklet here for talking to children about cancer from the Irish Cancer Society. And like you said about diagrams and drawing, they have a section in it, where you can help you kind of break it down into their language and at their stage. And I like the way you did it with age appropriate, 0 to 3, 3 to 5, how to navigate those different ages. And do you find with the teenage years, because they're able to access the internet, is internet kind of Dr. Google having a negative impact on the teenagers you're seeing coming through your clinics or anything?
Yeah, I suppose it's a really good point to bring up, Louise, because the thing is, what happens is children are going to Google either way, okay? Like that's what, so they have a choice, whether they do or they don't. They have to buy into what you're selling. So if they feel that you're not telling them the truth,
they're going to go and do their own research.
Yeah.
And then the mind will run off and imagine the worst.
Yeah.
Yes, the danger.
But if you keep them abreast with you, then that's where you build up that resources. You can name it. You can say, you know what, if you Google it, I always say to my clients and to children who might bring statistics into the space, statistics are fine if you're in the positive side of it, but if you're in the negative side of it, they're less helpful. And so you don't know what statistic you're going to fall into. And so there's a gray matter around that. But what is before you? That's your statistic, and your mom or your dad are there, and they're alive, they're well.
What's real and in the now? Yes, and bringing the whole family into what's real and what's in the present moment, and
exactly
not letting the mind run away with itself as the fears can do for parents and for children. And open communication, I suppose, just to clarify again with each other.
Absolutely.
Karen here would like to thank you again on such a brilliant presentation. And parents are so lost in how they broach the cancer diagnosis in their children, no matter what the children's age are. I think everybody struggles with this. We always see people and patients who struggle with this topic, especially on chemo or any of the treatments, and you've given so many great tips and how to start the conversation. So thanks again for that. And Mary said again, a wonderful and very important presentation. And just if you could forward your email there, I think you've put it in there again. Thanks, Yvonne. I see our time is kind of running out now as well. So thank you again from all of us, honestly. It's just such an emotive topic that can sometimes pull on the heartstrings and be very difficult for people to navigate on their own. So thanks for your professional advice and your input today. And we're still available here in the background if any parents want to talk offline after this. And for anyone just to there's more workshops coming up here in the afternoon if people want to stay logged in. And thanks, Yvonne, for today, for your talk.
Not at all. I'd like to thank all of you who've taken the time. The little people in your world are really lucky that you care enough about them to take the time to do this. And so whatever your story is, I wish you wellness and good health. But you're on the right track. The fact that you're open to having a conversation, you'll get there. And please feel free, as I say, if I can help any of you in any way, I do have resources more than the presentation allows, that I'm very happy. And I'd like to thank the Irish Cancer Society for always acknowledging this aspect of the patient's journey. And Louise, thanks a million for facilitating. I really appreciate it.
Thanks, Yvonne. Very kind of you. Thank you for today. Take care. Bye, everybody.